A Florida doctor has been indicted in connection with the death of a 70-year-old man. Dr. Thomas Shaknovsky accidentally removed the victim's liver instead of his spleen. That move resulted in blood loss and the patient's death. The filing also accused the doctor of 2 other instances of malpractice, including another alleged death.
First of all, there is something called situs inversus. It's a very rare but congenital condition when major thoracic and abdominal organs are just mirrored. Basically, in that person's anatomy, they are one in one side and the other one is on the other side. Also, there is a condition called liver walk or a beaver tail liver, when the liver has an anatomic variant where the left hepatic lobe or left lobe of the liver is basically extends the way to the left, essentially becoming inseparable from the spleen. Was the condition something like that? What type of preoperative studies were done? I mean, if it's a situs inversus, you probably would have seen it on a pre-op CT scan or MRI. If you're talking about beaver tail liver, the radiologic studies should have been done, and the report should have kind of warned him that this is the condition that you're going to be looking at. Proper radiologic studies should have been done or were done, and if the patient had situs inversus, that organs were mirrored, then he would have known about it. Or if it was a beaver tail liver where the left lobe of the liver is kind of grows into the spleen and it's difficult to separate them, then that is possible to recognize on the radiologic studies, like a CT angio, etc., or contrast. So those are things. The preoperative report, according to this one doctor, reading it, he had a splenic laceration and hemiperitoneum. Hemiperitoneum is when the abdomen is full of blood. And also the operative report indicates that when the doctor entered the abdomen, he saw a massive amount of blood. I'm not a general surgeon, even though I'm trained in general surgery, so it's difficult for me to comment, or I shouldn't be commenting on this competence or incompetence, or was this a malpractice or not. Definitely it was not intentional. Criminally, should he be charged? I really don't think so. But altering medical records was totally wrong. The end of the procedure stating that I removed the spleen when he removed the liver, because it's obvious that at the time he was already so stressed and confused, he didn't know what he was doing, but medical records should not have been altered. At the same time, I wasn't there. When my patients come in for revision surgery, let's say revision rhinoplasty, and they ask why this happened to me, I cannot criticize your doctor because I wasn't there, so I cannot criticize this doctor. One thing I can say, visualization is everything. That's why I ask my anesthesiologist to do what's called hypotensive anesthesia to decrease the amount of bleeding as much as possible, and I use medications for that too, so that I can see what I'm doing. It's very hard to operate even with a little bleeding, whether you're doing endoscopic brow, especially when you're doing endoscopic surgery, because laparoscopic surgery is an endoscopic surgery, like I do endoscopic brow lift. You get one minor bleeder and already things don't look good on your camera, even though he eventually did combination of open and laparoscopic because it was an open assist. So one hand basically pushes the liver and the other hand is working with the scope and cutting the adhesions or the ligaments. He called it adhesions of the spleen, but it probably were the ligaments of the liver. But upon removal, everybody recognized it was the liver because it was rushed to the lab, to the pathology lab. But I would say you enter the abdomen, you see massive amount of blood. First, before you start cutting any organ, just make sure you see what you're doing. That's given by someone who does cosmetic surgery, not a board-certified general surgeon who does laparoscopic surgeries. But visualization is everything. Preoperative studies, and not just relying on the radiologist's report, but looking at them yourself, looking at the spleen, looking what's happening, what what needs to be done and where it is positioned. Are we dealing with the condition of situs inversus, or are we dealing with the condition of a walking liver, or the other name is liver tail? You need to be prepared for surgery. The second, you should revisualize what you're doing. Third, I'm sure at one point the surgeon recognized that this is not right. We're doing something wrong. We're removing something different. And at that point, instead of very nicely removing this liver, stopping all the bleeders, clamping all the vessels to stop the bleeding, but then obviously there was so much blood loss that patient had a cardiac arrest on the table. But doing all that, so-called removing a clean liver, or being able to finish the surgery, but knowing that your patient is going to die without a liver, that's not acceptable. But it's so hard to comment on something that you were not there, you didn't know what state of mind he was, and when did he realize that he was removing the wrong organ, and when did he realize it. Again, what type of studies were done preoperatively, how did he prepare for it, what did he do to stop the massive hemorrhage abdominally, to be able to see what he was doing, because obviously you can remove wrong organs even if it is in the wrong side of the abdomen if you don't see what you're doing. So visualization is everything. One, experience tells you that don't panic, stop, recuperate, and then proceed and save your patient's life. Doesn't matter what it's going to end up at the end. Just save your patient's life. Care for your patient, not what's going to happen to you. Totally, I am not qualified to criticize, and it's easy to criticize after the facts. We were not there and saying, oh, it's a bigger, liver is so much bigger, 3 times bigger than a spleen, heavier than a spleen, this and that. It's easy to say after the fact, but you were not there and you don't know what was happening. It's bad. I feel bad for this surgeon, but if the preoperative planning was not done properly, that would be a big criticism, and the second criticism would be altering the medical records. And then the rest is up to a board certified good general surgeon to say, and again, if there is no video to see what was going on, then it's hard to comment on this. Either way, it was not intentional, so I'm not sure about criminal charges, but things happen. I mean, if you're becoming a surgeon, you're going to be a surgeon, you need to be prepared that things will happen. Make sure you see what you're doing, and make sure you're prepared for what you're doing, and make sure you're prepared for complications.